Erectile implant surgery. Your questions and answers. Brought to you by fixED. www.fixed.net.au.
At any one time in Australia today, 10% of men are suffering from some form of erectile dysfunction, or, to put it a little more plainly, they have difficulty in getting and keeping an erection in order to satisfy themselves and their partner to complete their life together. Many patients ask me, why are they having trouble with their love life, or why am I impotent? And I start out with a little bit of frivolity and simply ask, well, you probably chose your parents poorly. By that I mean I'm hinting at the most common cause, especially in older men, of why men's erections just aren't good enough, and that is vascular disease. Now, most of us understand what vascular disease is, but many men and their partners are surprised to hear that vascular disease is by far the most common cause of inability to get a satisfactory erection for an excellent love life. There are other causes, of course, such as medicine. Some medicines are well known to affect performance. Some men get depressed around about 50 to 60 years of age, and recognising that life's not a rehearsal, and they have to be explored to make sure that they don't have mental causes for their lack of performance. Certainly, in order to get a reasonable erection, we obviously need a penis. We need a blood supply to the penis, and also we need a nerve supply. And I have to be a little bit detailed here and explain that the nerve supply we're talking about are not the pleasure nerves, but amazingly the nerves that supply the blood vessels in our penises in order to tell the blood supply to open up and, in a sense, hydraulically force blood into the penis in order to give it satisfactory rigidity and durability. So once again, coming back to where we started, vascular disease is the issue. Now, amazingly, diabetes can bring forward vascular disease far more quickly than one would like. In fact, 50% of men at around about 65 to 70 do have some form of erectile dysfunction. And with diabetics, especially insulin-dependent diabetics, round about 50, almost all of those poor men are impotent. Now that we understand the causes of impotence, what do we have in this modern age? And we really are living in a wonderful time when we understand what causes impotence, but now we have some excellent treatments for it. So life's pretty good. The first one is to exclude any correctable causes which we've touched on, such as medication, diabetes, trying to improve the physiology of patients, and also with the statins, perhaps cleaning out some of those arteries that are clogged. But moving on from that, the first line therapy, of course, is medication. And we've all heard about the love pills, the Viagra, Cialis, Levitra. All of those work quite well if the arterial supply to the penis isn't completely blocked. But eventually, of course, the initial causes of impotence will progress in spite of what we do. And in many cases, even on presentation, the so-called love pills simply don't work. But all is not lost. The next line therapy is to have self-injection therapy. And once again, the press is loaded up with all these advertisements for penile injection therapy. Not a pleasant thing to talk about. But the great advantage over the injectable therapies is that it's an extremely small needle, it's a small dose of treatment, and it works instantly, and in many cases works far better than the medication. But of course, eventually, the injectable therapies won't work, or some complications from the injectable therapies, such as laying down of fibrous tissue in the penis, then that means that we have to move on to the next line of therapy. So what we're really here to talk about today is what is probably one of the best forms of treatment, and that is inserting a penile implant such that erections can be had spontaneously at any time and for any duration that the partners wish. So let's talk about the three-part inflatable penile prosthesis in a little more detail, But before we do, for a matter of completeness, there are semi-rigid implants, but let's just mention that and then move on to the three-part inflatable penile prosthesis. The great advantage of these prostheses, and they're all hidden. There's nothing outside. Many of my patients become a little concerned when they see the plumbing that needs to go inside, but it is all definitely inside, and nobody knows that it's there. And in many cases, the partner wouldn't know it was there unless their husband or their partner let them know that it was. It's very spontaneous. It has a pump in the scrotum, easily palpated through the skin of the scrotum, just beside the testicle, plenty of room there, but please make sure that you grab the right component when you're pumping it up. So there is a pump in the scrotum, and it takes saline from a reservoir which is hidden deep in the pelvis. And instead of blood being pumped into the penis, which would be the way it was when they were younger and capable, now we have 2 cylinders implanted into the penis without taking any of the contents of the penis, the natural tissue, away. These cylinders are pumped up via a pump in the scrotum, taking fluid from the reservoir, and it's a very natural and seamless transition from the flaccid state to the erect state, just like it is if it was naturally occurring. And at the end of lovemaking, no matter how long it has taken or short, then with the release valve on top of the pump in the scrotum, it is very easily let down to the flaccid state and really mimics of all our treatments exactly what nature does. So let's step back a tad and recognise that it takes 2 to tango. And all of my couples that come in are very concerned, basically from 2 points of view. From the man's point of view, he does not receive the signals from his partner to engage in spontaneous activity for fear of failure, and they usually withdraw. From the woman's point of view, they feel that their partner has lost interest in them, because many men do not know how to broach the issue of their inability to make love adequately to their partners. Generally, the woman partner then doesn't trouble their husband, so you can see we've set the scene where frustration reigns supreme. And very unfortunately, some women feel that, well, then their partner must be getting their sexual satisfaction elsewhere, all from the sake of just not recognising the physiology of ageing that causes impotence. So this drives home the point that adequate explanation of the ageing nature that causes impotence is very important to explain to especially the woman, let alone the man, that there's no loss of attraction here. It is simply that the body has physiologically failed in a very important organ called the penis. So where to for a man who finally admits that he does have a physical problem, and he braves talking about his issue to his general practitioner? Let me just mention that not only men and women have trouble coming to terms with the inability of a complete sexual life, some doctors don't feel comfortable about talking about sexuality, not because they have any particular reason other than that maybe they missed that lecture at med school, or they just like to keep it private, so that for the poor unsuspecting patient, let alone fessing up to what is a very personal question to perhaps a very friendly and well-liked and respected GP, they tend to seek help elsewhere. So there's a little bit of a warning here that if the first approach to their typical normal general practitioner meets with less than satisfactory directions as to how to and what to do, they shouldn't be put off by this and seek help elsewhere. Certainly once they get a referral from a sympathetic general practitioner, it's probably best to send it to someone, a specialist generally, and usually a urologist, who is interested in the mechanical correction of erectile dysfunction, who has a very easy attitude towards sexuality and relaxes not only the man, but also his partner, and explains the physiology. And it is absolutely wonderful to be able to explain to them that it is an ageing process, it's not psychological, and here we have a magnificent way of correcting his problem. So yes, definitely seek advice, but be prepared to have to seek it far and wide. So in summary, it's most important to seek out help and advice from a urologist who has adequate training and willingness to talk about this subject, and go to it.